My name is Michael Laufer. I'm chief spokesman for the Fourth He's Vinegar Collective, and I'm here at Hope to recruit you because there's still a lot to do. As was mentioned, I was here 2 years ago, and I want to thank Hope for having us back. A lot has happened in the last 2 years, and I hope to show you guys all of that and also what happened before. So, I want to start just by talking about the hacker ethic, as we do. I feel that hacking is an ethical concern. It's a good, and I argue that it's the greatest good, because what it does is it takes what's available and it leverages that in order to do more than what's allowed. And it does it for the greater good in all cases. And so many industries and movements still have so much to learn from the hacker movement that we figured out decades ago, the most important of which is the free sharing of information. This got figured out in the hacker community a long time ago, that if you kept your secrets and you said, oh, no, you're too much of a newbie, I won't show you that means that newbie is going to go out and screw it up on their own. Now, the medical community has not figured this out. The chemical community has not figured this out. The biological community is starting to figure this out, which is why we have coined the term biohacking, and so many people are doing it, and it's a great blessing. It's wonderful to see. Now, specifically, we work in global health. We are trying to get medicine and medical technologies to people who otherwise wouldn't have it, however we can. So, if you didn't see my talk 2 years ago, there's me on the left. That's me throwing pills of Daraprim to the audience while Martin Shkreli was under house arrest. And I called him from stage at this phone number. Now, unfortunately, this phone number doesn't work anymore because he's in the clink for realsies. Now, that doesn't mean you shouldn't get in touch. If you want to write, you can write to him. I did. He didn't write me back, which is a little weird only because when I called him, despite the fact he didn't pick up the phone, a few hours later, I had a conversation with him in the lobby, and it was weird but interesting. Now, here's the fascinating thing about the whole debacle with him. He got offered up as the sacrificial lamb. He's rotting at Fort Dix. And yet, despite everything that happened, the price of Daraprim didn't change. It's been 2 years, and the price of Daraprim didn't change. Torrent Pharmaceuticals, nobody talks about them anymore. Martin Shkreli's in the clink. Cool, we got ours. Everybody who needs a drug for toxoplasmosis is still screwed. I suppose I should pass out more, right? Yeah. Who wants one? So, these are 200 milligram pills. Usually they are, here, I'll just make it rain. Usually they're 50 milligram pills, but your first dose you take 4 of them, and so that's equivalent to a first 4 dose. So it's $750 per pill at a quadruple dose. That was a $3,000 pill I just threw out for each of you. And don't worry, it only cost me 25 cents to make. Special thanks to the collective member who helped me make them this morning before the talk. Okay, so the other thing that we got known for was that shortly after we were here at Hope, we had a website set up, and the whole Mylan thing came down, and EpiPens suddenly skyrocketed in price. And a lot of people got in touch, probably people in this room, and thank you, got in touch through the website and said, why aren't you doing something about the EpiPen? Why aren't you doing something about the EpiPen? We kind of wrote back and we're like, well, we kind of do chemistry stuff. And they're like, but you're doing health. Come on, make it happen. And so we did. And this was the EpiPencil. This is what came out of that. And we figured out a way to utilize off-the-shelf parts and build an epinephrine auto-injector for $30, which is reloadable, and the reloading only costs about $3. Now, this got pretty popular on YouTube, but YouTube's kind of, they said we were endangering the public. So now our good friends at the Internet Archive and the Alexandria Project are hosting it. You can still find links on our website. Interestingly, also, we weren't confronted directly by the FDA, but they did issue a statement saying, don't make your own EpiPen. Go pay extra. Despite the fact that you can buy a syringe and epinephrine and give yourself an injection, and it's perfectly legal. Loading it into an auto-injector that's designed to inject other things, very bad, naughty, naughty. If that irony weren't thick enough, the next thing that happened was that EpiPens started failing left and right. They recalled 80,000 of them. Every pharmacy you walked into had a big sign saying, do you have EpiPens? Do you know that they don't work? This is the interesting thing. EpiPens are single use. You can't test them. If you have a reloadable injector, you can test it as many times as you want. You can make sure it works. And they dropped the ball when they said, you guys screwed up. And then on top of it, there weren't enough for everybody. As if it weren't insulting enough that they were overcharging and they failed and they weren't safe and you weren't supposed to make your own. Also, you just couldn't get them. And again, similar to Daraprim, after all this time, it's been about a year and a half, the price hasn't changed. It's still $609 for a pair of EpiPens. Now, I saw the house lights just went down, but here I'm just going to show you. This is the setup. It's the auto injector. You take the needle from one syringe, you plop it on the other syringe, you load it, and you're good to go. Is there anybody here who suffers from anaphylactic shock? 1, 2, 3, 4. And of you, are there any of you who do not have EpiPens? So, who wants this one? Oh, sorry, I can't see. And that's one of the original ones that we did in the first video, so use it well. Now, similar to Martin Shkreli, there was a woman who was terribly demonized for jacking up the price of a life-saving medication and being insensitive and being a terrible capitalist and lying to Congress and, other things that are frowned upon. It'd be cool if I could call her too, right? Like, at this number? What do you think? Should we see if she answers? All right, let's see. So, this is a fixed VoIP. So I don't know how it's going to pan out, but let's see. 1412 741. Don't everybody call it once; it'll block the line. 2395. Is this microphone on as well? Yeah, here we go. I mean, it's ringing. I mean, maybe she's not home. I'll leave a message.
Password.
Ooh, password. What do you guys think it is, huh? I'm trying 1, 2, 3, 4. Oh, it hung up on me. All right, well, if there are any VoIP hackers out there, if you can find me the password before the end of my talk, I'll call her back. I tried. All right. Okay. Let's move on. this is HIV. I don't need to belabor the point of how horrific it is, but suffice it to say that every 3 minutes somebody dies of HIV. This is GSK 744, which is going to be marketed under the trade name cabotegravir by GlaxoSmithKline. And with a single dose, an 800 milligram intramuscular injection 4 times a year, it can keep your viral load below detectable, and it also acts as a pre-exposure prophylaxis, which means that you can go into a community where there's a high viral load and just give it to everybody. You don't even have to deal with the stigma of testing. This could wipe out HIV in a closed community, which of course doesn't exist, but theoretically in a single generation. But it's not on the market yet, so you can't have it. It's up to GlaxoSmithKline, who owns the molecule, as to whether they're going to do that, and also how they're going to price it. They have not discussed how they're going to price it, but my guess is they're not going to be giving it away. This is hepatitis C. Also, a big deal. Only every 3 minutes does somebody die of hepatitis C. This is Sovaldi. This actually cures hepatitis C. This is a huge deal because hepatitis is a virus. With most viruses, you live with it for the rest of your life. This drains the viral reservoir and destroys it. You take 1 pill a day for 12 weeks, and you do not have hepatitis C anymore. The problem is, those pills are $1,000 a piece. So you have to have $84,000 of loose cash rolling around in your pocket. So if you're rich, hepatitis C isn't your problem anymore. Nobody in this room, huh? Yeah, me neither. There's an epidemic of opioid overdose in this country. It's a huge problem. Luckily, there's an extraordinarily simple solution. This is naloxone. It's marketed under the trade name Narcan. It's getting to be more available. For a long time, you could not get this outside of a police station or a hospital. And not to say anything specific about what's happening when you're overdosing on opioids, but typically, you're not going to want to go to a police station or a hospital. It's getting to the point where it is more available over the counter in certain states, but still hard to get. Even in the places where it's over the counter, you have to give your name. You have to get a on-the-spot prescription, at least in California. It may be different in New York, and a lot of places you still can't get it. There are over a dozen botched abortions that happen every minute, and many of those lead to fatality. These 2 drugs, well known for decades, mifepristone and misoprostol, can 95% of the time perform a safe, easy abortion with no problems within first trimester or so. But even in places where abortion is allegedly legal, like the United States, it is very difficult to get and is criminalized and leads to any number of very difficult things. It says a lot about the state of humanity when we spend so much time and energy doing so much good science, so much research, and we refuse to give these medicines to the people who need it. So, what's the gap? What's the hack? What's the workaround? How do you fix this? Well, make it yourself. But that requires chemistry. All right, that's okay. People are still scared of science. It's a stigma. It's something that's going to be around for a while, probably. But if you think about the 80s, or movies from the 80s, there was a terrible stigma against computers. Everybody was like, oh, scary computers. Now everybody's got one in their pocket, and another one on their lap, and another one on their desk at home, and it's not a big deal. A dozen years ago, rapid prototyping was a weird word that was a niche industry, and nobody knew about it except for select few people who worked really hard with gel and UV lasers. Now 3D printing is a word. You just say it. What jumped the gap? It seems that in all these cases it was 2 things: a good user interface and a little bit of automation. A little bit of automation goes a long way. can you automate chemistry? Hell yeah, you can. So these are automated chemical reactors. They're commercially available. Theoretically, you can buy them. I mean, you can't buy them. I can't buy them. Why? Well, they're full of proprietary technology, so you can't work on them yourself. If they break, you're out of luck. They're ridiculously expensive, and they will only sell it to you if you're a lab. I mean, like, yeah, cool. I know we could all pass as a lab. But still, that means you can't just like send away for it in the mail or go down to the hardware store and buy one and go home and do chemistry. But you should be able to. Just like 3D printing, just like hacking on a computer, you should be able to do it with chemistry. It's more fundamental, arguably. And we've seen so much happen in terms of trying to bring the hacking ethic into sort of, tangible things. Single board computers, laser cutters, the whole works. So how do you jump? So this was the very, very first version that we built. Very hacked. It was just a mason jar. We punched some holes in the top. We put a tea warmer in there and a little thermocouple to measure temperature. Hooked it up to a PID controller so it regulated the temperature. And then there was a tubing in there that sort of stirred things by circulating the fluid. It was hooked up to a fish pump. It was very, very basic. We made aspirin with it, and it worked, right? It was one of those proof of concept moments where it's like, oh, this is maybe not quite as crazy as we thought. So from there, it evolved. We got a pressure controller there. There's the PID unit and the little circuitry that ran it. Some friends from Rainforest Connection helped us start doing the automation. First thing that we did was on Arduino Uno and some breadboarding. Those are banks of little like chip relays to kick things on and off. One for the stir, one for the heater that controlled it, and what's the other one? The third one was for the syringe pump to inject new reagents. So here it is running. We put some LEDs to make it pretty. Here are the syringe pumps. This was an open source project that was developed by some medical people. They found this was a really necessary thing. It was ridiculously expensive, and it's just not that complicated. You have, a screw motor, and you have a syringe, and you clamp it in there, and it works. And so here's a version of it, and I'll go over ours in particular later, and we have a special one here as well, which I'd love to show off. But it progressed. This was the original version, though. This was a cassette loader from a from a data bank that I'd scavenged, and it worked. I mean, not well, but close enough is close enough. So then more people started to join the collective, and people who were enthused about 3D printing said, "Hey, maybe we can 3D print some of this." And we shied away from it at first because we were like, well, not everybody has access to a 3D printer. Let's try and use off-the-shelf parts. But as it turned out, it solved more problems than it created. And just to show you guys, here's that core, or a similar one. And as you can see, it's three pieces. It bolts together. And you have an input for the stir motor. You have an input for the reagents to get into the inner chamber where the reaction happens. And then you have two that come in that circulate fluid. And so this is what it looks like assembled, and I think that's this one. It's not as similar. And that was a huge step forward for us. It was really great. And we moved off of Arduino. We started working with the Raspberry Pi because it's cheaper, it's more flexible. That's the Raspberry Pi Zero, if you recognize it. In the lower right there, you see me holding a breadboard with the Raspberry Pi Zero in the corner there. And I'm happy to announce for the first time that we now have PCBs designed. And here's the schematic. So one thing I should just pause to say right now is that even though I'm the only person you ever see in public from the Fourth East Vinegar Collective, there are a lot of us. This isn't me, okay? I don't do most of the technical work. This is done by experts who are brilliant, and they worked so hard for so many things that you're about to see. And I just want to say thank you. Some of them are here, some of them are watching. Here's what it's going to look like. we're going to be at DEF CON, and hopefully these will be manufactured by then, and we'll be giving them away because we don't sell anything. We only give things away. Here's what the backside looks like, and the traces look about like that. This will also be freely available, so if you want to manufacture them yourself, you of course can. Now, things got dark from time to time. We didn't just get trouble from the FDA and trouble from YouTube. I was invited by Dr. von Hippel to come to MIT and talk to his friends about things that seemed cool. And he seemed so terribly friendly until we were in private. He told me that he thought I was going to dismantle the last 40 years of his work. Because, he said, 3D printing didn't start with guns. Somebody's going to do something reckless, and then nobody's going to do any chemistry ever. And I thought, really? I kind of have my doubts, and I know some people who I think would disagree with that. And he said, dismantle your entire operation, change the name, stop doing it, stop talking about drugs. And I was like, dude, I don't think you get it. I wasn't setting out to try to do chemistry. I was setting out to try and get medicine to people, and I didn't care how. Happened to be that an automated chemical reactor was one of the better ways to do that. It didn't really click. But in honor of this very unpleasant set of conversations I had with him, I'd like to introduce our new core. This is a single piece printed device. I'll show you more. And we call it the von Hippel reactor. Isn't this thing beautiful? Look at this. It's all out of one piece, and it still has all the same structural elements. There's an inlet port here for reagents. There's the stir motor shaft here, and then there are the inlet and outlet ports for the circulating fluid. And you can see when it's together, this is how it looks. It's just awesome, right? Again, I'm admiring it because it's not my work. But anyway, so here's a photograph of it. And in addition, the hardware team that's been doing stuff with 3D printing said, we should scale. We should have options for both everything being off the shelf and also for everything to be 3D printed, or as much as possible. So we also have a syringe pump that you can 3D print almost the entirety of. And look at this bad boy. Isn't this gorgeous? I was demoed this morning, and it turned on via a phone app. I mean, so diesel. You gotta love engineers when they over-engineer things, and you're like, shoot, I just wanted something that worked. Okay, so there's more. In addition, there's a file format. I'm sorry, my mic just got louder. There's a file format because you have to give instructions to the machine. So we've developed a format, and I'm sorry, it keeps dropping. It's a blend of Python and YAML. And it kind of looks like this, and if you look at it, you can sort of see it's not complicated, right? We have a fairly simple set of things that we're trying to do. You stir, you control temperature, you inject reagents at particular times, you put in some safeguards to make sure that nothing's going wrong. But it's nothing terribly complicated, which is why it's ridiculous that it's tens of thousands of dollars to get one off the shelf when you could build it yourself. It's just that nobody's done it yet. Well, I guess we have. So, back to the medicine part, we have an issue with many explorations into medicine that, like, big data is going to be the magic bullet that cures everything. It's not. I mean, I love big data as much as the next guy who has a background in math, but seriously, if there's anything we've learned about cancer, it's that if you get cancer, nobody's had that cancer before because it's yours. And it's about that individualized. And so in order to tackle these types of problems, it's a tailoring problem. And interestingly enough, it seems like this is true for lots and lots of ailments, not just cancer. So there need to be new approaches, and there are. Now, why is it that people aren't managing their health already? And I'm sure there are a few, hardliners in the audience who say, well, I do. Cool. But most people don't, unfortunately. What's happening? Why are we just so used to the way that things happen in the medical industry? You get this feeling that something goes wrong and you go to a doctor and he fixes you, or she. It's not the case. Whatever they used, that already existed. They didn't create it. They just curated it. And not that that's a useless thing. Curation is good. But why couldn't you have done that yourself? It's because it's illegal. If you decide that you're going to go out and make some medicine or buy some medicine without a prescription, that's illegal. You can't think for yourself. You can't decide you know what's wrong with you. I don't think that's right. And the only logical explanation I can seem to find as to why this is in place is because it hooks you into a system for which you have to pay. It seems to be the explanation for a lot of things. But let's not get too down on capitalism right now. So, there are a lot of methodologies. If you're ill, you know what's wrong, and you know what you need, and you can't get it, there are lots of ways to go about it. Now, many of these, they're not terribly sophisticated, but you have to think about doing it, and you have to actually go for it. One is, you can just buy them. I know everybody here uses the internet. The drugs are out there. You want something, you can get it. Doesn't matter. Another thing that's extraordinarily easy, that's often overlooked, is that chemical suppliers often stock the active pharmaceutical ingredient of whatever it is. It's not for human consumption. Fine. It's not their business. Buy it, put it in a capsule. You're done. Get a scale. Get a good one. So, you can buy the precursors, right? If there's something that's very similar and it's a simple chemical reaction to get to the next step, most of what we're due, you can do that. On top of that, do the research. There is, and I know everybody in here knows this, there is so much technology that's on the shelf that you can't get for silly reasons. It's no different in the medical industry. There are tons of things. If you have something that ails you, go read about it. Use Sci-Hub. It's awesome. And you can find out that there are things on the shelf that may cure what you have. You just can't buy them. And again, there's this stigma. You don't know. You're not an expert. You didn't pay $300,000 to go to medical school. Cool. Manage your own health anyway. Experts are just human beings. Yeah, maybe they know some things. Maybe they know some things you don't. Ask them. Figure it out. They had to learn a lot of things. You are just a single person. You don't need to give health to 1,000 people. Just take care of yourself, or maybe somebody else. Virtual trials. We're working with a group called Cancer Commons. If you have an uncurable cancer, please go talk to Cancer Commons. They're amazing. And what they do is they do these virtual trials doing what I've just described. They know the literature so well that you give them all of your data, and they're like, oh yeah, there's something that somebody thought might work, but they couldn't get a trial together. We'll have to go figure out a way to make this drug or buy it. And they save lives every day, and they're just wonderful, wonderful people. So there's no reason that something similar couldn't happen with regular diseases, or orphan diseases specifically. Now, I need to talk about the chemistry a little bit, because this is the place where everybody always gets hung up. They always say, oh, but chemistry is difficult. What if you get it wrong? What if the reaction goes poorly and you manufacture something you didn't want? It turns out to be poison instead of the medicine. What if it blows up? A million different things. The big gag that we worked on so hard for the first year or so after we stopped being an underground organization was trying to build new reaction pathways that were safe. They didn't have weird side reactions, even if you screwed them up.